Hey, Helen, good morning.
Good morning, Zach. How are you?
I'm doing quite all right. Melissa has very graciously invited me to come and take some notes for our project, so I appreciate you guys' work.
Cool. Where are you from?
I'm over by Lake Johnson down in Southwest Raleigh.
hmm You said taking notes for a project?
Oh, sorry, me and Melissa are in a class together.
Oh, cool.
Yeah, it's fun.
What class? I'm just being nosy.
No, I'm nosy for a living. It's like a strategic performance management thing.
Oh, that's
Um, yeah, so you all are incredibly lucky to have her full time. I only get to see her a couple hours a week, so you all are very lucky.
I think we are absolutely.
Good morning, Helen. And Zach is like underselling himself. Zach is extremely organized. He's really great to work with. I don't know what the person who gets him in a job is going to be so amazed because he's excellent.
But we need a lot of amazing people in what we do. So,
How are you doing?
me?
Yeah.
Well, the first part of the week I was in Nag's Head at a conference. Wishing I was still there. How about that?
I was about to say there are worse places to be.
It was so bad that I didn't even go into Durham yesterday. I live in Smithfield, and I worked home yesterday because I just can't go to Durham today. But I have to go today. So as soon as we're done here, I'm hitting the road to get back because we're doing vaccines for our EMS folks today. So I've got to go and take care of that.
Oh. Are you going to be able to do anything this weekend?
This weekend? Yeah, a few things. Probably catching up on housework.
I understand. I use the weekends for chores too.
Yeah.
Morning.
Hey, Colin.
How are you?
Jonathan's not going to be here today. Just FYI.
What a slacker.
Yeah, he's at a training conference. So he emailed me this morning.
Very good. Assuming Sharita will be here.
I hope so. Hope we have at least two more.
Well, I don't think we have anything to vote on. I think it's just setting our agenda.
Yeah.
One of the things I was thinking about, Helen, was possibly trying to think of some, instead of having all of our HSAC meetings being like presentations, information only, if we wanted to come up with some topics of discussion that we could sort of have some high level conversations about, and then maybe the HSAC directing things back to policy and planning to explore and come back with a plan, like sort of more details on recommendations on how could we solve X with a little bit of guideline from the HSAC. It may get more people involved and help close that knowledge gap that exists in some areas.
Yeah, that's a good idea. I think that goes along with what I was saying yesterday that I still can't remember yet because I got to go back and look at my notes. That idea I had that I wanted to talk about.
Sure.
As soon as I remember what that is.
We'll figure it out.
It was a good idea, I thought. I just don't remember right now. I've told you so many ways with those grants right now. It's driving me crazy. And you work with grants all the time. I never have. This is my first experience being a grant project director.
And what I will tell you is with grants, as soon as you get done writing it, it's time to write it again for the next go around. And while you're trying to write the next one, you're trying to implement the first one.
Unfortunately, these are 4-year grants. The one's a 4-year, one's a 3-year. And then we got another opportunity that I got to look into. It's due by the end of the month. But the other cool thing I'm learning is that you can probably take a lot of stuff from your previous applications and cut and paste them to the new ones, so you're not reinventing the wheel every time.
That is true. That is absolutely a very true statement. It's perfectly okay to recycle.
Yeah, especially since they don't know what you wrote anyway. So.
No, and they don't go back and check and see what you wrote from one year to the next.
Okay. Well, hang on a few more minutes and see if more board members show up. Or executive committee members besides me.
I'll text Sharita. I don't know if I have Shay's number or not, but I'll check.
Sure, I don't. And Russ should be here too. Does he? I guess he knows.
I think he might be on vacation this
Oh.
week.
Well,
We're out of town.
Yeah, I think that's right. That he still has his email set up.
well, I guess we can forgive him then.
Text Sharita and see if she's able to join.
Well, if not, like, well, whatever Colin says, that's what we'll do.
Yeah.
So Princess, welcome to the meeting this morning.
Thank you. Glad to be here.
Yeah. We're doing our agenda planning. Welcome, Zach. I guess you guys met before I jumped on.
Yes, I did, Colin. Of course, I'm sure you know, but I work very diligently with Melissa in our class, and I'm happy to be here studying you all. So.
Yes, I remember hearing about Zach as part of the master's team.
No, I think you guys are doing really incredible work, and it's awesome to find out how the actual sausage gets made.
Yeah, it's interesting you use that. Back in the day, I was the executive director of a nonprofit, and the president of our board, when I left, he had to step in and fill until they could find a new executive director. And
Sure.
when he started coming to meetings, he said, wow, the homeless system is very much like a sausage factory.
No.
You really don't want to know what happens in the background, but you really like the sausage at the end of the day. So it's really amazing, all the stuff that happens in these meetings. And I mean, this was a different jurisdiction where
Sure.
there was a lot of like politics and a lot of
Yeah.
stuff about it. He's like, wow.
That's
So
great.
are you like the sausage king of Chicago? Like reference to Ferris Bueller. It's like,
That's wonderful.
no. We just work our way through it. It's like, yeah, but if you don't understand how the process gets made, you don't lose, man. You gotta know how the sausage gets made in order to win funds. And that, I think that's true everywhere though, is you got to understand all the processes and what's required and how to do it. There's just not enough money for everything.
Did Rita get back with you yet?
No, I just texted her. I called her yesterday. She was going to call me back, but I think she got tied up.
Mhm. Well, I guess we can go ahead
We
and
can get
start.
started.
We're already almost 10 after, so.
Yeah, some folks, and I think Lloyd had a meeting scheduled at the same time, so
Right, I remember that.
I can share my screen with our agenda planning document, and we can sort of go with that if you would like, Madam Chair.
Go right ahead.
All right, so I just kind of started putting things in here. I'll have to check with, and Melissa, you and Ruby may know, did we get any like HSAC members that wanted to be put on committees?
There were a couple that mentioned it in the meeting that we asked to email us. That way we could add them, send them
Okay.
specific registration invites. As far as I know, we didn't have any of those come through.
Okay, so we just need to follow up on those.
Mhm.
Okay. Go ahead. All right. Okay, Sharita said she'll be joining, but it'll be a few minutes. I'll let her know we might be done in a few minutes.
You probably will have some ideas about topic meetings
Mhm.
to get that.
Okay. So some of the things that we could do, we could, just, we did submit the COC NOFO on time. Our special NOFO is in the process of being drafted, and that'll be due October 20th. So if we want to do any discussion or talking about that at the meeting, Helen, we could do that. This is the one that's specifically for unsheltered homelessness and requires a whole bunch of, partnerships and things along those lines.
You said that was to be ready on the 20th?
It has to be submitted by 11:59 p.m. I think it's 11:59 p.m. on October 20th.
Okay.
And then I know we need Shay to run the meeting in November. So I just kind of put this here as just a reminder for us, not necessarily a public announcement, but we could also make it a public announcement just so that people are aware that you're out of town doing a training.
Yeah.
If you'd like. And then if we had HSAC members to appoint to committee, but we should make an announcement to remind people.
Especially since some people seem to be interested, but they never followed up.
Mhm. Maybe we can let people drop an email or drop their send email or drop info in the chat, and we can grab it from the chat, and then we can do some targeted outreach. I think it's an executive committee update this month, Helen.
Probably. It's been a little bit.
Yeah, I was going back because we did policy and planning in August, and September was performance management. So I think it's up to us. So I think it would just sort of be a pretty brief update, because all we've been doing is planning meetings.
Pretty much.
And then I thought either we as a group here could have some discussion, like talk about possible topics that we'd want to bring to HSAC for discussion input on a high level, or we could have some of that as a discussion at the HSAC to try and collect some ideas, and then we could map out topics that we want to cover in these meetings.
I think
Yeah.
and/or is probably good, because you know how people are about giving their ideas right up front. But maybe if we start with some special topics and say, this is the kind of thing we're looking for. What are your ideas?
Yeah.
I know yesterday we were talking about the housing choice vouchers and the lack of case management assistance with. Maybe is that something that would be a topic we could discuss? It's like how we improve in that area, or
I think we could talk about how HCVs work and where we have some gaps, which may also go into kind of our gaps analysis discussion. Because I think we are going to think about changing how we do our gaps analysis, instead of making them. Historically, what we've been doing for gaps analysis have been very highly academic research analysis versus systems gaps analysis that we can replicate every year. I think it's important to sort of talk to the HSAC, perhaps after policy and planning noodles it around of having a discussion with the HSAC about, the pros and cons of shifting away from the academic gaps analysis and getting to an overarching system analysis that can be, repeated annually so that we can actually see our progress. And then if we have, master students who are looking for a thesis, we can always have them do a one-time deep dive on one particular topic, but there's no guarantee that that one deep dive will ever get done again, or that the data that we receive from that may not be easy to follow up the exact same way and ensure that we're closing a gap, for instance.
Well, that makes sense, because the one that they started doing has taken a really, really long time.
Because it's a qualitative and quantitative data analysis, and it's on, I want to say it's mental health and substance abuse. It's a really narrow set of criteria that's being explored on that gaps analysis. But if we were going to replicate it, we would have to go out and essentially do client surveys again, meeting with people to get the qualitative data. And that's incredibly time consuming. And then you got to figure out, how do you quantify qualitative data, finding those themes to put together a report. And then just because you follow the methodology once, if you don't have the exact same people doing it exactly the same way a year later or 2 years later, your results, you're going to be apples to oranges.
Well, what are your thoughts about a combination? And I'm not saying each year doing both kinds, but perhaps a systems analysis each year, but periodically every 3 years, every 5 years, doing the more academic one like is currently being done. Because that seems to be more in depth and gets to the root of people's opinions, the qualitative experience, right?
Yeah, I think we could do that. I think that's a good suggestion. I think what the issue comes down to, at least right now, is to do those academic dives. You need somebody who like it's basically they're either a requirement of a master's program, or we have staff capacity to lead that kind of thing. And historically, we just haven't had the bandwidth to do everything in our portfolio to do that kind of academic research.
Right.
So I think we could definitely sort of keep it out there and work on building relationships with the universities and say, hey, anytime you have students looking to do a policy analysis or gaps analysis or needs assessment, we're always open to that discussion if people want to explore homelessness, low-income housing, or low-income issues that impact vulnerable populations that tie to the homeless system. We would welcome those kind of things.
Yeah. That sounds very reasonable.
And then, yeah, I would assume probably every year, every couple of years, we'd probably have a student who would have an interest in the homeless system. Because, if somebody wants to do an analysis on, I'm trying to think, like if a nursing student, like a public health student was like, oh, I want to look at diabetes in the homeless system. Okay. There's probably a gap of care and where to store insulin, that insulin has to be refrigerated. So, that there's a gap there. How could we solve this? How could we make insulin? And we do know that people experiencing homelessness have higher rates of, chronic health conditions, including diabetes. Are there things that could be put in place? So, yeah, I think there's ways that we could do this.
I'm taking notes.
Sure. Any other discussion topics that would be good to? And the HCVs, we could sort of do it as a HCV / housing subsidies, and what supportive services goes with what. because I think that's one of the big pieces. We were talking about it in our by names list meeting yesterday, was we've been using HCVs, or housing choice vouchers, for chronically homeless individuals who have high barriers to housing. And often when individuals or households have those high barriers, they need the ongoing supportive services, yet the housing choice vouchers don't come with any supportive services, and there isn't a separate set aside of money to pay for that case management. So are we really using our limited housing choice vouchers for those who are most likely to be successful in that program? I think that's and then you're talking about the pros and cons of rapid rehousing. It's sort of an educational piece, Helen, is what I'm thinking of, what comes with each of these housing options. What does rapid rehousing come with? How does that work? How does that compare and contrast with permanent supportive housing? How does that compare and contrast? So you've got all these different things. What do each of these interventions mean? And how should we use each of these interventions? And I think that's where we are right now, is trying to go back and look at these interventions and see, are we using these interventions as effectively and as efficiently as possible? Because right now, every one of our interventions is geared for the hardest to serve, the most chronically homeless and hardest to serve individuals or households. And by definition, each of these projects cannot provide that level of services to everybody at that high needs. Rapid rehousing is meant to be a light touch, short to medium term intervention.
Mhm.
And if you're using it for people who need really intensive case management and long-term help, you're going to run into problems after 2 years.
Right. Makes sense. I think that would be good, because especially for people like me who don't do this every day,
Mhm.
some of these terms and things
Mhm.
tend to start running together, and it's the differentiation between the two. It's a good refresher. Even that, I mean, I've heard it, I've known it, but again, I don't do it every day, so I think I know I forget what the distinctions are at times. I think that would be good. I'm wondering too, if all the things that Lloyd has been researching and doing with this special
Mhm.
COC NOFO, if there's some things that perhaps he's identified that would be good to research and discuss.
Okay.
I have a quick question.
Sure.
All right, so that's kind of what we wanted to do when we applied for the recent NOFO that came out. Even though we were not suggested as one of the firms to receive money, that's really what we wanted to do, because my husband and I are both previous social workers, and case management is so essential to, changing the trajectory of someone's life. So I was thinking, like, what is a way that we could, I guess, is it hard to get funding for something like that? Because you guys are saying that it's a need in the community, and you don't want to just give people a voucher that are going to be in the same situation in the next day or the next month or the next year. And to me, it's probably not the best use of our resources. So how do we get a case management aspect involved into the whole process of helping people transition from unhoused to housed and stable?
So that's a great question, Princess. So you would, if I'm hearing you correctly, it's how do you find the funding to provide the supportive services to people in the housing once they're in housing?
Yeah.
Okay.
Yes, because I think about, like, I did social work for like 10, 12 years. My husband did it for about 15 to 17. And technically we still do it, because as pastors, part of ministry is providing people, connecting people with resources. They come to the ministry in need. So it really never stops. But I just think about like some of the adult and children clients that I had. I mean, I had an average caseload of about 120 people, and a lot of it was heavy case management. Let me tell you how to go over here and get a bank account. Let me tell you how to go over here and make sure that your disability check is going to be approved and sent to the right address. Or let me show you how to go get Medicaid because your blood pressure is out of control. Let me show you where you can go to a discount pharmacy. Like, it's so much case management involved with people who are, you know, just limited, whether that's intellectually or financially. And I really feel like in order for us to help the unhoused people in Durham County, we have got to start getting in, like the street ministry has to increase. We've got to start helping and filling that gap. And that's what we want to do at A&P Penn.
Sure. So in order to pair supportive services with housing, there's a couple ways to do it. The first way is applying for a rapid rehousing project, where rapid rehousing is literally the only people who qualify for rapid rehousing are households who are literally homeless. And that is a short to medium term rental subsidy and short to medium term supportive services. So, you know, if you applied for a rapid rehousing project, you would have money for security deposits and rents and utility deposits and utility payments and money for the case managers to do that supportive services. Then you have the continuum of care application, which allows for permanent supportive housing. And permanent supportive housing is different than rapid rehousing in that you must meet HUD's chronic definition of homelessness. And to be chronically homeless, you have to have 12 months of solid straight through homelessness and a disabling condition, or 12 months of homelessness within 3 years. So if you have that permanent supportive housing piece, that comes with money that can be used either for rent, and that you can use that for as long as you've got the contract and the person still needs to remain in that program. So there's people who've been in PSH for 2, 3, 4, 5, 7, 10 years sometimes, because they still need ongoing supportive services.
Right.
And they need the subsidy, the rental subsidy.
Right.
Then the lowest barrier that we have are the housing choice vouchers. And some communities have used the housing choice vouchers as a way of moving people out of permanent supportive housing. So if you have somebody in permanent supportive housing who came in with a disabling condition, but let's say after 3 years, they are doing really, really well. They're able to take their medications. They're functioning well. They're integrated in the community. They've got support networks. And really, they don't need the supportive services. They just need a subsidy because they're on a disability income. Then you might give that household a voucher, and they would sort of move on from permanent supportive housing, and they would maintain the subsidy. But then you would take your permanent supportive housing subsidy and the supportive services to the next person in line who needs that. The way we've set this up in the past, or the way this got set up years ago, was the vouchers that we were using in our public housing placements that were available to us. We were sort of putting chronically homeless or almost chronically homeless people into programs where there is no supportive services available.
Okay, like shelters, is that an example of like a program that you might put someone in that's homeless, or is it like public housing, like, you know, housing projects?
So you've got both. The emergency shelters are there for highest need. We've been prioritizing our emergency shelters for households or individuals who are most likely to have a negative event remaining unsheltered, i.e., you know, a victim of a crime or death, or women. Yeah, like the risk factors that are going to set you up for a negative experience being unsheltered. So I like to use the example of a healthy 25-year-old male is probably not going to get an emergency shelter bed as fast as a 65-year-old female who has health conditions. You know, it's just young and healthy. You can probably weather the elements better than somebody else, or a 25-year-old male may not get a shelter bed before a 18-year-old female, because the 18-year-old female may have higher risk factors of negative outcomes due to age and gender and other issues.
Right.
So,
Okay, that makes sense.
and then when you're talking about the public housing, we are working with DHA to get some of our units implemented that we can refer people into.
Okay.
Yeah, thank you, Sharita. Good point. We also have limited female beds because historically females, we don't have as many females experiencing homelessness as we do males. And
Right.
that's been true across every jurisdiction I've ever worked in.
Yeah.
Males tend to,
Nationally, the algorithm is about 25% less female beds in your typical shelter.
Wow.
yep.
Wow.
And when you look at the demographics and you look at a point in time count, you have substantially less females experiencing homelessness than you do males.
Yeah.
But that also means that we have a lot of women at risk because they end up on the street because the beds fill up faster.
Exactly.
Yeah. Yeah. And I'm just thinking about my time at the Helen Wright Center, where we dealt with a lot of women through Interact that were in Wake County that were abused, and it was always a struggle trying to find a bed for them.
Mm-hmm.
Because the ratio was just out of control. Like, it was always, and I mean, all of them had like qualifying factors. They had young children, they had been in an abusive relationship, they decided to leave the abusive relationship via the emergency room after an abusive attack. Like, it was always so much to try to figure out where. And I get it. I mean, owning a shelter for people who are in their circumstances is not the most profitable career, but we just need more of it. And it's getting worse, especially with the recent hikes in rent. I mean, people are paying 12, 13% more than they paid just last year to stay in the same place.
Mm-hmm. Nope, you're right. And the challenge that we have is, yes, there's a need for more emergency shelter. The push on the larger level is for more affordable housing or more
Right.
subsidies to make housing affordable. So you have a choice. Do we open more emergency shelter beds that just become full? Because if you spend your money there, then you have nowhere to exit people into for affordable housing. So the flip is, you don't necessarily need more emergency shelter beds. You just need to turn your beds over more frequently. So if we actually could get people into affordable housing and end homelessness and get people into subsidized housing, we would have a natural flip over that, you know, people wouldn't experience unsheltered homelessness as long as they currently are. And it's a challenge. And yes, Sharita, you're absolutely right. We do have a lot of people relocating to Durham, coming here for rescue mission and for other projects and programs that are in Durham that end up sometimes experiencing homelessness in Durham. And once they're here, they're like, oh no, I don't want to go back to wherever I started.
Yes, I see that all the time in my full-time job. People leaving their home country and they cannot return.
Yep. So.
Well, I just want to say that if any of the organizations need help implementing anything in Durham County, they need extra hands, extra people, they are definitely willing. We are willing to do the work. I know that we were not suggested to receive funding this time, but we're still here, available to work, and we're doing the work. So
Awesome.
Please share our information to anybody. We don't mind riding on someone else's coattail to help fix the issue, because that's what we're all here for.
Yeah, I think that's great. I think, you know, network and spend some time. 'Cause you guys are, Princess, your agency is doing a lot more of the street outreach type stuff, correct?
Yes,
Gotcha.
currently we are feeding people about 300 people a week. We go out 3 to 4 times a week, and we try to at least feed 75 to 100.
Mhm.
Our partners are Trader Joe's, Whole Foods, Panera Bread, Jersey Mike's, and a local pizza shop by my house. And we're just about to start financial literacy classes at Oak City Cares, which is another nonprofit in Wake County. We're
Mhm.
going to host those on Thursdays, not every Thursday, but Thursday once a month. We're in partnership with Self Help Credit Union.
Yep.
And what we'll be doing is just, Oak City Cares basically is like a in and out situation. You come in at lunchtime, you get fed a hot meal, you can take a shower, you can wash your clothes, and then you have to be out at like 3 o'clock or whatever. And so what we're going to do is just offer financial literacy classes and start with the basics, needs and wants. How did I get up and get in the situation that I'm in? What decisions did I make that were poor choices? How can I learn from those choices and move on to the next thing? And just kind of really make it so that people can start to look systematically at their situation objectively and say, okay, I, started drinking really heavy and this is why I'm homeless. Because I spent all my money on food or whatever it is. Or I have an undiagnosed mental health problem that I've been thinking maybe be there, but I just won't go get help. So will somebody hook me up with a counselor that can, get me to the place I need to be so that I can be stabilized with medication? But that's what the financial literacy program is going to do. And we're planning taking that on like a 6-month tour with different communities on 1 Thursday a month.
Okay. Very cool.
Yeah.
Well, Princess, thank you for all that you do. Remind me the name of your organization again, please.
A.P. Smith Community Partner, Community Development Center.
Thank you.
Yeah.
Appreciate it. Tarita, just to catch you up, I know things are tough and it's hard to get here sometimes. We've been talking, obviously just going over agenda stuff, but we're working on right now is just some ideas for topics for meetings. Those meetings where we don't have it jam-packed full of things that we absolutely have to do. It'd be great to have some ideas for other things that we can talk about from an educational perspective. And so we were looking at talking about the different types of programs like housing choice vouchers and what they do, what their purpose is, what supportive service goes with each type of program that we have, what the interventions mean. I asked about special topics from the special NOFO that Lloyd's been working on, that maybe there's some things that he has identified in that we could do. And then Princess has been talking about her organization and we were discussing some things about, you came in the middle of that, so you probably caught the gist of most of that, about case management and making it more effective in the systems that we currently have. So we're still looking for ideas for topics to talk about. And I told Colin when he brought that up, I was like, Tarita has to be here because I know she's got ideas.
And if there's someone that can give me the contact information for housing for new hosts, I reached out to like a generic email. I didn't get a response. So I'd like to really, Lloyd suggested that I reach out to them and kind of develop a relationship.
With who?
Housing for New Hope. I think
Oh, okay.
New Hope for Housing. Am I saying
Yeah.
that?
Yeah, since it may be good for you to reach out to Russ Pierce. He's the executive director. Reach out as executive director to executive director.
Okay. All right. That sounds good.
And I think he's on this
someone
committee,
like-
but he's out of town this week.
Okay. Perfect. Thank you.
So Tarita had said harm reduction.
And we don't have to think of every topic. We're also
Right,
thinking about maybe using this as kind of a starting place to get some discussions started at this meeting so that we could generate topics from the HSAC that they would like to explore, discuss, come up with some overarching, themes or topics that they'd like to talk about, and perhaps not necessarily solve in an HSAC meeting, but have some discussion and prioritization on some things that might get kicked back to the committees for, more details and more in-depth, figuring out possible solutions to some of these challenges. Because we're kind of all over the map right now because we've been managing by crisis because we've had COVID and not enough staff and everything else that's come our way. Trauma informed. What do you mean by, are you talking about trauma informed care and chronically homeless, Sharita, or are you suggesting
One topic, trauma
Okay.
informed care and the chronically homeless.
Okay.
Especially in light of recent events that I've been privy of around pocket knives and inflexibility of some of our providers to understand the significance of those pocket knives, not as our people trying to do harm to anybody inside, but more so about protection and kind of what that signifies and what it means for them as far as safety and security. I think that it's timely and that we probably should be talking about that so that we can make sure that our policies take trauma-informed care into consideration.
Mhm. We should do some review updates of our written policies and procedures.
I agree, because I think when I got the last call that I got, I tried to go into the policy and procedures to see if I seen anything in there, and I didn't. So, yeah.
One of the things that we found out from our HUD monitoring is HUD has HUD regulations that we have to follow. We as a COC have written standards, and then agencies have their policies and procedures. And all of these are supposed to connect throughout. And what we're finding from our most recent monitoring is there's sometimes a disconnect in between one, two, or all three of those, and trying to get those a little bit more seamless and working through the documentation. So we'll probably be working with HUD to bring in some technical assistance to help us and help the nonprofits, help the service providers, get things lined up and follow best practices on documentation and services, and trying to get some of these things lined up, which would be good. But yes, Sharita, you're absolutely right. There are some policies like, wait a minute, why is this in here? And one of the things that I want to talk to you about for policy and planning is looking at how we're using our housing choice vouchers, and how we're getting that prioritized, because we may be doing things backwards.
I agree.
So I was looking at this and talking to the by names list committee yesterday about how and who needs to be referred where, and sort of asked what their thoughts were about the policies. And they're like, well, it doesn't make sense. I'm like, okay, I just wanted to make sure it wasn't just me. But we're not going to pilot this until we talk to policy and planning first and take it to the HSAC and, make sure everybody understands and has a chance to weigh in before we start piloting stuff in a vacuum. That doesn't work well. All right. So I think we've got some ideas that we can throw out. And Helen, do you want to take some time at this meeting to sort of see if the HSAC has some other ideas?
Sure, yeah.
Add to this list? Do like a 5 or 10 minute brainstorming session?
Yeah, we can plan on a 5 and 10 minute or 10 minute. We'll see how it goes. It may be a 1 minute.
That's been my experience, is it has been a 1 minute.
So I think we should plan for 5 minutes, so just in case.
Sure. At some point, Sally Wilson had asked about doing a presentation on medical respite. Is that something that we want to ask if she's still interested in doing, or?
I think she's still interested, and I think it would be a good idea.
Okay.
We would probably have time at this meeting if she's available.
I think so. I can ask her. I didn't reach back out to her, but because I've had it on there and keep moving it every month just due to other higher priority needs. But if it's something that you all think is worth doing, we can give her what, 10 minutes, 5-10 minutes.
Yeah.
I don't know how much time you think we need.
I don't know how much time she needs for a presentation, but
Sharita, do you have any thoughts?
About how much time? I would say give her 10 or 15 minutes.
Okay. And that would include the time for questions?
Yes, in my mind.
Okay. So we'll have a potentially a pretty short meeting.
you always say that. It never works out.
I should stop saying it.
I know.
Right. Just kidding. We're gonna have a really long meeting. It'll probably have to be continued into the next day.
I'll be saying, y'all go ahead. I'll catch you
Sure.
around next time.
All right.
Let's give her 20 just in case there are some questions. Let's not set ourselves up.
Yeah, we should have time for that. I mean,
I think so.
I don't know how long she really needs for the presentation because I don't know how much material she has to share.
I don't know.
Yeah.
And yeah. Don't know. But I will ask her and let her know that we've got.
Okay.
Then we had made at one point for the mayor. What happened with that?
Oh man, we talked about that. I think at the
Like
time,
3 months ago.
yeah, we talked about it, and then the mayor was in the process of appointing people to boards. To sort of get her thoughts on homelessness in Durham.
Mm-hmm.
And then if we did that, we would also need to invite the chair of the county commissioners as well. If we're going to invite the mayor, we should probably elect the senior county person as well, just to be equitable.
I think that's a good idea because I think what we had talked about when we were talking about it was every time leadership in the city changes, that we all often, at least extend an invitation, send them a communication, let them know that we're here, we exist, so they don't forget about us, and then invite them to come in and share any thoughts they might have.
Well, maybe because we've got council members and, commissioners on the HSAC. Yeah, let me, there's like a process that we have to go through to make that request. So let me talk to Reginald and maybe, well, Drew Cummings left the county. So Helen, you might know the process of asking a commissioner to who's the chair of the commissioners? Is it Howerton?
Brenda Howerton, yeah. You have to go through their clerk. Normally I would say Drew, but Drew's no longer with us.
Yeah.
Don't remind me.
What's
Do
that,
we know
Steve?
who they've appointed?
They don't have anyone appointing his position yet.
That makes an invite even more important, so they don't forget that we need somebody appointed.
I mean, Heidi's is still with us.
Right, but we don't.
We
Okay.
don't have a staff member. Well, we've got
We don't.
Helen. Helen's a staff member of the county.
This is true.
And she can go
Well,
rattle some
Jonathan as
pages.
well. I mean, actually, Drew did reach out. He emailed me, Jonathan, and Heidi about, he had talked with our county manager and with Commissioner Howerton, that position needed to be filled as quickly as possible. But in the interim, that any of us, if we had things that needed to be brought to the board, that they were aware that we would be taking care of that, bringing those to either Commissioner Howerton or to County Manager Sewell.
How does she pronounce her last name? Sewell?
Sewell, yeah.
Sewell, okay. Yeah, I told Drew, like, all right, well, if nobody gets appointed, I guess I'll just have to go straight to the county manager, huh? He said, good luck.
Yeah.
Okay,
I was late to the call because I was actually on the phone with someone at Alliance trying to get somebody to come do a talk at my church about the substance issues we're having in our city right now, especially with the new designer kid-like drugs, and kind of what to look for and how to support folks if they are presenting in a way that you're not quite sure what they've gotten into. I think that maybe later on we probably should have a conversation about it, or maybe if the full HSAC decides on that harm reduction conversation, maybe we can turn it into a substance abuse and harm reduction conversation as opposed to just harm reduction. I think we need to talk about it though, because these new drugs they don't show up on screens and all of these things because we don't know what to look for, and they have all kinds of names, and it is especially impacting our transition age youth.
okay.
Some of them are not opioids, but they have similar side effects.
Right.
So they don't respond to naloxone because they're not.
Right. I actually just had a very close experience with this, so it is in the forefront of my brain. So
Well, even fentanyl doesn't show up on the regular urine drug screen. Even fentanyl doesn't show up because it's synthetic.
right.
You have to do a special screening for that.
Right. But you have to know what you're looking for.
Right.
And apparently there are quite a few new things I hadn't even heard of. I was away at at a national conference, national council retreat earlier this week, and we spent a whole lot of time talking about the new designer drugs.
Well, that's going to be one of the things that education is one of the big things. This grant that we've got, EMS, that we can work on that as well as we're doing our outreach and training for the community through that.
I think that would be great.
Shalita, do you mind sharing your close experience you had with something new that you referenced just a few minutes ago?
Who is that?
Princess Smith.
Princess Smith.
So it's personal, but my son actually was encouraged by some friends to try a gummy that he thought was harmless, and it turned out to be harmful. We were at the hospital. They gave him the naloxone. He did not respond to that. So and once I had my experience, I had several other young people in my circles around the like late high school, early college age that had experiences. So it is here, and our kids, it looks like candy. So our kids
Right.
and our young people are trying it.
Yeah.
And they may see that in the shelter and not know what they're looking at. If the person is not able to tell them what they've had, depending on what state they're in, even giving somebody Narcan is not going to solve the issue. And the staff needs to be equipped to at least try to be able to identify or understand a little bit of what they're looking at, because depending on how it impacts, one of the people that I know actually threw up Another person
Oh.
had a severe altered mental state, and there was like problems with their blood pressure and all kinds of stuff. So, you know, it impacts people differently. It doesn't manifest itself the same way.
Yeah.
Wow. Thank you for being transparent. I was really curious.
And I'm a clinician, so when I had my personal experience, and I know what they were saying that my son consumed, but what I was seeing did not match. It didn't line up with what they said that he had. His behavior was totally not what I expected to see. So, yeah, I would imagine as a person working in a shelter or working with youth, if they had that type of experience, they wouldn't know what to do. I mean, the EMS didn't really know what to do. You know,
Right.
thankfully, my son was with somebody and they called me and I was able to give a whole lot of information, and the person stayed with my son long enough to give them some information that my son couldn't give. So
How's he doing now?
I don't know. It's hard to tell because, you know, they say some of the effects could take a long time to wear off. He seems to be more himself, but he's still making some choices that I'm wondering if he's still impacted by it. So I just don't know.
Did they figure out what the drug was, Sharita?
So what he's saying it was THC gummy, but it was like 100 milligrams, which is like
Like a
10 or
crazy
20
huge
joints at
dose.
one time.
Mhm.
Yeah.
Oh, wow.
Hmm.
Wow. Like, wow.
That is scary.
Yeah.
And the solution is if the person comes into the shelter and they're altered, like you don't turn them away. You need to try to get them help because you don't know what's going to happen.
Right.
So, you know, I think that the shelters need to have a response plan and all kinds of stuff because it's just not going to look like what they've seen before. Or maybe they think they know what they're looking at and it's not that.
Do you have any, I know I was looking at what you had said about you have access to the NHC council.
So when the National Council told me that they can do technical assistance, and if I wanted them to come and have a harm reduction or substance abuse conversation, that they would be able through me to extend it to our COC. So I can have that conversation if that's something that folks are interested in. We would just then have to coordinate, you know, folks or when they could do it, but it will probably, I don't know if they would come down. It will probably be, well, it'll probably be a Zoom, but I think that would be fine. But they told me that that would be something they would be willing to do.
Yeah, I think that would be great and definitely timely. As you said, it's not something we need to wait till we have an epidemic of it on the streets.
Mhm.
People need to know now and understand what to look for.
And I was talking to Alliance staff trying to see if they had somebody who did outreach as it relates to that. And I think they have a person that kind of does some services, but I don't know if that person is they couldn't. The person I was talking to was Deneen. She didn't know if that person was is up on the new designer stuff right now, as we would need. And she gave me some suggestions. So the suggestions she gave me, I'm gonna look into them. One was Wanda Boone would try.
NC harm reduction.
Possibly, but as I put my list together, I will report back to you guys to see if we can make something happen.
Well, that's like I said, as part of our grant that we just got, the harm reduction grant that we just got is to facilitate education on licit and illicit substances in the community. So I think that will certainly qualify.
I would agree.
And I know we're partnering with Wanda, and we're partnering with NC Harm Reduction, Lofton Wilson and Reed Getty.
Well, that sounds great because I'm gonna have I'm gonna reach out to Wanda today, and so Deneen feels like Wanda is the person, and she will help us get what we need to be
Sure.
able to do what we need to do. But I feel like, like I saw it on the news a few weeks after I had my experience. Then I got a call about another experience, and then I had 3 other experiences with young people, and I was like, okay, this is getting out of control. And all of the experiences happened before the news, that is out. So I think that we're gonna see it more often.
Yeah. Okay, that sounds good.
Probably so.
Well, it is 11 o'clock, or 1 minute till.
Yep.
But it's definitely something, Sharita, we're going to pursue and move forward on. We definitely need to do that. Do we have everything we need for the agenda, don't we?
Think so.
Okay.
I think
All
we're
right,
good
then.
on that.
And so Sally's presentation, just real quick, Sally's presentation will be for this upcoming meeting.
For the October meeting.
Okay. So I kind of let her know, because I was asking her about time. And she's like, when? So I think she'll be ready.
Good.
Yeah, I was going to email her and let her know that, she had, and just follow up, because she had requested it from me a while ago. And I said, well, you can always sign up for public comment, but if you're looking to do a special presentation, then that would be, we'd have to schedule that on an agenda and figure
I
that
need
out.
to be doing a presentation on SOAR, because we need some people doing disability applications, because I keep turning away emails.
I think I do
Add that to our
know
list.
that if HUD funds this unsheltered special NOFO, there is money for dedicated SOAR workers in that proposal.
That's great. We need them.
So hopefully we're gonna write the strongest application we can and hope for the best. And if we get it, there will be some dedicated SOAR staff in there.
Awesome.
And then is Duke planning to refill the SOAR positions that ended, or do we not know?
So Duke is still trying to determine how they're going to go forward.
Mhm.
I think what they're considering is like spreading that out and not just having a dedicated SOAR worker, but having it be a part of a case manager's, kind of like what I do.
Mhm.
So it's something I can do, but I'm not doing it all day, even though I end up doing it all day. But I think that's what they're going to try. But we're having a meeting with Duke, a group of us who've done so. We're having a meeting with Duke to kind of inform them and talk about what that would look like. And I'm definitely going to give them my experience at trying to manage it and everything else for people. It's definitely a challenge.
Mhm. Well, and if they could commit to it and they could say, hey, we're going to do this, and we could help 10 unsheltered people with SOAR scoring, and this is what that value is, it would help us with our application to get some more SOAR workers so that their people wouldn't have to do all the work.
Well, if I'm not mistaken, Malik, who had left Duke, is now employed by Housing for New Hope, and I'm assuming Malik is doing SOAR for Housing for New Hope. So if that,
Sure.
that would give us at least one for how that Housing for New Hope have a person on street outreach who has done SOAR before. So that would be great for us right now, but we definitely need more.
Absolutely.
Well,
I'm sorry for interrupting your closing of the meeting, Helen.
no, it's okay. I was just going to say, I've got to go. Y'all are welcome to stay, but I've got to drive to Durham and get ready to do some vaccines this afternoon with a 1 o'clock start time, and I got things I got to pick up. So
I understand. Thank you.
Y'all can stay. Y'all go ahead.
You're good.
All right.
Thank you all very much.
Do you got a few minutes? I'll give you a call and we can figure out the policy and planning agenda. You got it. Call you in a minute.
All right.
Thanks, everyone. Bye.